Good morning. Welcome to OpenLabyrinth Virtual Patients. So what the heck are virtual patients? Well, for starters, we're not talking about goggles and virtual reality and all that stuff. We're talking about stories, the power of the narrative. And you might want to think of these as much more like choose your own adventure books. Do you remember those? Where you get to the bottom of page 37, do you want to rescue the dragon or do you want to slay the princess? Or if you want to be boringly conventional, the other way around. But anyway, as you work your way through the stories, different things happen. Well, that's what we're trying to do with our virtual patient cases. Now, one of the things that is important here is that most virtual patient cases in the past have tended to be very linear, and we're trying to encourage our authors to develop branching cases that we actually have consequences and decisions that you have to deal with. This is getting away from the classic header design, so history, examination, investigation, diagnosis, treatment, so HEIDR, that's going through a case in a very linear format. We want to move more into having cases which unfold as a story. The first case I was introduced to has become quite well known now, the Sarah Jane case, which was written at St George's University in London. Lovely little case where very, very simple, and one of the key principles in it was that, as Alistair Cook said in Letter to America, the pictures are better on the radio. There was not a single picture in this. It was very much the text description which would tell you about the case, about the smelly dog sitting in the corner of the room, things like that. And it unfolded very nicely. And the trick to this one was that if you didn't catch on very early on that this was a very sick child, then she would meet a sad demise, very challenging. And just through clever story and clever decisions and making you think about what you had to do. So we have a number of cases over the years, a number of libraries around about. One library that some might want to look at with lots of interprofessional cases. This is written in an older version of Labyrinth, but at the Pine Library, so check that out. How do you generally use virtual patients? Oh, a lot of it is just used for simple case presentations, just for learners and students and physicians to play by themselves. But we've also found them very useful in small group discussions, and in particular for some projects such as this one, we've taken a flipped classroom approach where you explore the case content at home by yourself, look at the cases, and then discussing your choices and what happened in the class afterwards. So homework first, as it were. So within OpenLabyrinth, everything's tracked. There's timing, there's paths, counters, etc. So you can actually track blood pressures and various other things just by assigning scores and numbers. The amount of time spent in a node is measured, and this is all graphed out so that we can actually look at how people perform and also how the cases performed, so it can make our cases better. This has been a very powerful tool for assessing clinical reasoning. How do docs think? How do the medical students and residents work their way through a case? So what do you actually need to write cases? Really very simple. You just need an OpenLabyrinth server. Ask us if you want to try one of ours, but it's a very easy thing to set up on a web server. But more importantly, you need interested clinicians who can tell good stories, and then it is helpful on your own team to have someone who's got just some very simple HTML web design expertise just occasionally to help you out, but that's not crucial. Some case examples. What we'd recommend doing is going to this site here, vp.openlabyrinth.ca, and you can log in if you have a password, but there's a number of open cases on there, and 3 or 4 you might want to check out right off the bat. We have a virtual patient on virtual patients, VP on VPs. We have a quite linear case, but it tells a nice little story about a dizzy blonde. There's a street drug guide, which is designed for mobile access with lots of tiny cases built into it, and then of course we have the CAMH opioid dependency cases on that server. Come and have fun.